Hey there, y'all. Thanks for joining in for the second video of week 2 of our series in celebration of American Pharmacists Month. Today we're going to be talking about 5 essential resources that any healthcare provider needs if they are trying to sort of get their feet wet in freelance health content writing and want to move into freelance health content writing as an additional source of income, as an additional opportunity, professional development opportunity to layer on to your existing role as a practitioner or a clinician, and all that good stuff. And the reality is that when we come through whatever type of academic program you would have come through, so for pharmacists, that would be pharmacy school, or for physicians, medical school, etc. When we came through our academic programs, for the most part, the training and support that we all received was threefold. There was the didactic information and education that we were taught, like the actual things that we had to learn. There were the experiential opportunities that we had in order to be able to see those ideas and concepts in practice and also get the opportunity to kind of practice in them. And then third, there was the mentorship component. So you probably had faculty advisors of different types. You might have had mentors who were already active in the profession or working in their respective practice areas. And all three of those layers of support were a part of the training that we received as we came through these academic programs. All three of them were necessary in order to prepare us for practice and for being in the respective health professions that we chose. The same, I believe, is true of freelance health content writing. So it's not enough to have the information about content writing without having the practice or the mentorship. It's not enough to have the mentorship without having the knowledge and the information or the experience. And it's not enough to have just opportunities to practice if you don't actually have the underlying baseline knowledge that you need and the support that you need to move forward. Good evening, Chester. So it's really important to have almost that like similar triangulated curriculum where you're getting the support that you need on all sides, because the goal is to be effective as a health content writer and actually like get clients and actually make a difference by creating content that will live online, that the general public is going to come across when they're asking the questions they have or trying to find answers to the problems they have. So within that kind of triangulated support system, I think there are 5 essential resources that any healthcare provider who's interested in transitioning into health content writing is going to need. For those who I haven't had the opportunity to meet yet, my name is Megan Freeland. I'm a public health pharmacist by training, have worked as a health content strategist since about 2016, and currently run the Health Professionals to Health Writers program, which teaches US-based pharmacists and healthcare providers how to replace a portion of their income through freelance health content writing. Now, to move on into those 3 points those 5 essential resources that I want you to remember. The first is information. So if you are kind of just coming into the sphere of medical writing and just beginning to learn that medical writing is actually an umbrella term under which health content writing falls, but that there are other things under that medical writing umbrella as well, then you might have heard me talk about the fact that freelance health content writing is very distinct because content writing is actually a part of a larger, more expansive process known as content marketing. And so when you are interested in becoming a content writer, one, it is an advantage that you're a health professional because you already have that health knowledge, experience, expertise. But what you are less likely to have is that understanding of what content marketing is. And that's really important because the patient education part of health content writing is usually what we as healthcare providers are really passionate about and what makes us really excited about health content writing. But from a business perspective, that business is really engaging. It is really seeking to work with content writers because they are engaging in content marketing. So it's really important for you to have the basic information about how content writing ties in with marketing at large and be able to really connect the dots from a business standpoint, so that your advantages as a healthcare provider can be combined with that information and that knowledge that you have. So that's part of the reason why in Health Professionals to Health Writers, we start in phase 1 with just some really like in-depth learning about the entire content marketing landscape. The second resource that's important for you to have is a set of foundational writing skills. And when I say foundational writing skills, you can apply that to whatever language you would be writing in. So if you are a US-based healthcare professional and you would be writing for an English-speaking audience, then I'm talking about foundational English language writing skills. If you're a healthcare professional based in another location or who would be writing for an audience that speaks another language, then I'm talking about the foundational writing skills that apply to that language. So this is broadly applicable depending on, what audience you would be writing for or what types of geographic locations you would be writing in. Regardless, you need those foundational writing skills. Putting a sentence together on paper, which we know how to do that, verbally, but communicating that in a written way is something that can be challenging for some people. So it might take you some practice or learning to figure out how to confidently and comfortably do that. So how to put a sentence together, grammar, spelling, punctuation, all of those basic skills is really important to have those, because as you learn more about health content writing, you are going to be building on top of the foundational writing skills that you already have. And if you don't already have that foundation, then it's going to be really challenging to build those health content writing skills on top of that. It's kind of like building the house, right? You want to have a strong foundation before you try to put weight and load on it. So you want to have a strong foundation of writing skill before you try to build on top of that with health content writing skills or really any other type of medical writing skills. So that's the second key resource that you need, writing skills. The third is a portfolio. So this kind of naturally connects to those writing skills. But once you have those foundational writing skills and you've learned the health content writing skills on top of that, then what you're going to need to prioritize is the creation of a portfolio. That portfolio is going to contain samples that a company can look at to see evidence of your ability to write and to write for particular audiences. And if you don't have those samples to show as examples and representations of your work, it's going to be really challenging to convince a company that you would be an asset to their team, that you would be, that bringing you on as a contractor would be advantageous to the company. So it's really important that you have that portfolio of samples to show. And in tomorrow's video of the series, we're going to talk about how you know whether your portfolio is good enough. How do you know that the samples that you have in your portfolio are actually a good reflection and a strong reflection of your writing skills? How that you know those samples would represent you well if a company is looking at those as evidence of your ability. So the portfolio is important, but understanding what makes a portfolio good and even great is also really important. So make sure you tune in tomorrow for that conversation. But the portfolio is the third resource that you will definitely need if you are a healthcare professional who's moving into health content writing. The fourth is business support. So when I say business support, I know it sounds very broad. That's because all of the business support that falls under those categories is relevant and necessary. So whether that's like determining what your packages are and what the prices are, or thinking about what business systems you might need when you're like up and running and creating client work and invoicing and all of those types of things. We get that triangulated curriculum and education when we're in our health professions programs, but it's very clearly specific to practicing as that healthcare professional. We don't necessarily get like the entrepreneurship 101 or how to freelance. That's not really a standard part of our education. And so when it comes to finding that information, when you are ready to freelance or to create a business, it can be a little daunting, intimidating because there's so much out there. And we don't really have that background. So I would say that the fourth essential resource is just an understanding of what business support you would need, and how you would implement that in your business in order to set you up for success. And then the last essential resource is the mentorship. That includes tailored advice and coaching. and really just having someone there to answer questions that come up through the process, whether they are questions about content writing itself or a portfolio or the business systems that we just talked about, or any number of things that could happen in your journey. Also, when you start interacting with people in real life, like whether you're pitching clients or you're networking and trying to build relationships, um, sometimes situations come up that you've never been in before because you've never been a freelancer before. You've never run a business before. And so it's hard to even anticipate what those situations could be because you don't even necessarily have the underlying context to be able to anticipate what those things might be. But like if you were to ask some of the students who have come through Health Professionals to Health Writers, I'm sure many of them would say like, yeah, I certain situations came up and I'm just like, how do I navigate this? I don't know. And that's something that they're able to come to me with because having worked in the field for years and years, I've encountered a lot of those situations, and even those that I haven't, I kind of have some experience in understanding how to navigate those. So what I find is that whenever any of these 5 types of support are missing, people are encountering more challenges in their health content writing journey. And there are already enough challenges in that journey, even if you do have all of these resources and support. So it can be a little intimidating or demotivating, discouraging when you do realize that there's a level of support that you need that you don't actually have. That was a lot of my experience as I was becoming a health content writer myself. Going through that process, I didn't really have a specific resource that I could look to and say, all right, this is the first step, this is the second step, this is the third step, these are the things that I need to check out the box. It was very much trial and error and figure it out on my own and learn from my mistakes and try again and get knocked down and get back up. And at that time in my life, I was going to say I had time. I really didn't have time, but I made time. But it worked out. If I were at a different point in my life, that might not have worked out. I might not have had the time to be able to kind of DIY and piece things together myself, or might not have had the energy to weather the storm of figuring out a whole industry on my own rather than having someone who could guide me down that path. So my experience was the opposite of the experience that I tried to create for students and health professionals to health writers. And honestly, going through that on my own and realizing in hindsight how helpful it would have been to have a step-by-step path is a huge part of the reason why I created this program in the first place. So I know many of you already know that enrollment for the January cohort of Health Professionals to Health Writers is still open. You can leave the word "write" in the comments if you might be interested in applying. But it's one of the things that I'm most proud of is being able to provide that triangulated curriculum that we talked about, and also all 5 of these essential resources, being able to provide that to my students and knowing that that was something that I didn't have, but could have really benefited from. And that would have really sped up the beginning of my freelance health content writing journey. Like what took me 3 to 3.5 years to learn and to master is what I have condensed into this 6-month curriculum. So thinking like, dang, Megan, if you had a blueprint to follow, you could have done this in, 6 months rather than it taking like a year to get to where you want it to be financially. So it's just these are the things that I think about, that I thought about when I put this curriculum together, and that I think make for the most effective way to transition from being a healthcare professional to being someone who's able to operate as a freelance health content writer. So if there are any questions that you have about any of those resources, please feel free to drop them in the comments. And remember to tune in tomorrow when where we're going to talk about how to know if your portfolio is good enough, things that you want to ask yourself in order to make that determination, and then strategies that you can use to help make sure that you are putting forth the strongest portfolio possible. So I'll see y'all then, and have a good night.